Tip number 3, practicing your skills, okay? This is the perfect time whenever you start learning your skills, especially in the beginning of nursing school, to then be able to actually put it into practice. It's going to be your first hands-on with these patients. So you're going to be able, especially very first semester nursing students, you're going to be able to do head-to-toe assessments that you're going to learn. You're going to be able to take blood pressures, which you're going to learn. You're going to be able to dispense medications and talk about the medications and side effects and all of that stuff, because you're going to start learning that in the beginning. If you're a more seasoned nursing student going into your second, third semester, you're going to probably be doing a lot of other things. And again, you're only going to be able to do certain skills that you have been taught already. Those are going to be the things that you've already gone through, you've already been doing in a skills lab, you've already been taught. Every semester, you're going to have a different sheet of skills that you're going to be able to give to your nurse or the director or whomever of where you're doing your clinical, of what skills that they're going to be able to have you do, like what you're expected to do. If it's something, if you've never learned to do an IV yet, you're not going to be doing an IV on a patient, okay? It's only going to be whenever you have shown and had passed that lab, or that check off is what I'm trying to say, the check off for like doing IVs and stuff. They're gonna do those skill check offs before you can actually do it in a clinical setting. So you're only going to be expected to do the things that you've learned and that you've passed in your school, that you've passed in skills labs, okay? So when you further go on, it might be adding on, you can do head-to-toe assessments, you can probably do Foleys, med passes, eventually doing IV insertions, you can draw blood eventually when you learn about drawing blood from a central line, anything like that are going to be things, wound changes, wound dressings, anything like that you're going to be able to do. Again, it just depends on what you've learned up to that point as to what you're going to be able to do in a clinical setting. But this is going to be the most fun, I think, hands-on experience being able to do in clinical. You're actually going to be able to do it on a live patient. And let me tell you, it's a good feeling when you do like your first Foley and you were able to do it the first time, you were able to find it the first time, you know, and it's exciting when you actually get to do it on a real person. It's like little celebrations when you get to do things in person on a real person and be able to chart it off, right? So practicing skills, make sure you practice your skills, because you're going to be doing these skills when you're in clinical. You're going to be expected to. Your nurse, your professor, not your professor, your preceptor is going to then have you do these things. And of course, they're going to be there overlooking everything, making sure you're okay if you have questions or concerns about whatever that you're about to do. But this is the perfect time to do your skills. Like, it's the most exciting part of clinicals, I think. So that is my next tip. So making sure you're practicing your skills. Hey everyone, if you enjoyed watching that clip and you want to see the full video to it, make sure you guys click the box here. If you enjoy watching these kind of videos and you want to see more videos from the Nurse Kristen YouTube for pre-nursing, nursing student, new grad nurses, make sure you guys hit the subscribe button over here.